There are at least 4 passages in the Bible that make it Jehovah's Witnesses refusing to accept blood products. This religious prohibition applies to major blood fractions, that is, red blood cells, granulocytes, platelets, plasma, and whole blood. So one of the things we discussed yesterday at the Q&A was that one of the ways you can prepare for surgery that you know is coming, not an emergency obviously, is to store your own blood. That way, if you needed a transfusion, you get your own blood. But that too is prohibited by these religious observations. The decision regarding the use of minor blood fractions is considered a matter of conscience and is left to the individual. Some patients will decline blood transfusions for personal reasons, such as fear of an infection or immune reaction. And quite frankly, that seems to be justified. Does anyone know what the true risk of transfusion is in 2025? We kind of know what it is, the risk of getting HIV or one of the hepatitis, but not from what may or may not be related to SARS-CoV-19 or the COVID vaccine. The consulting hematologist needs to be understanding, clearly document the patient's reason for declining transfusion, and specify what products and interventions are acceptable to the patient. So in other words, spending time with your patient, hearing your patient, listening to your patient, again, part of that medical model that's worried about coding and billing and giving vaccines is not necessarily paying credence to the importance of the time it takes to get to know your client.